All right, so we're going to be discussing a subcuticular closure, both interrupted and running. And this is usually done, or it has to be done with absorbable suture. So here's an example. This is foromonacryl, which is the most common suture used to close skin after surgery. What we need is an adson to hold the tissue, a needle driver, and then a scissor to cut the suture. So in order to do an interrupted subcuticular closure, you'll pick your spot where you want to run your suture, a simple suture that's going to go from one side to the other, but you need to make sure that the knot is as deep as possible. So you grab the edge and you're going to go from deep below the dermis up through at the dermis-epidermis junction. Once you get that, you then pick the spot directly across from it to bring together. And this time, it'll go from superficial, right at the epidermis-dermis junction, down to deep through the dermis. Once you went from deep to superficial, then superficial to deep, you now tie your knot either with an instrument tie or a one-handed tie, and the knot will then go deep. Okay, it'll be underneath, out of the way, and it'll help prevent spitting of the knot. Okay, and then we can cut this. Okay, and then that would bring that together, as that would be considered an interrupted subcuticular suture. And again, with absorbable suture material. Now, if we were to do a running subcuticular from one end to the other, you would start out at one end doing the same suturing technique that I just described for an interrupted, where you start out deep, get through the dermis, out at the dermis-epidermis junction. You start near the corner of the incision, and you go then the other side, superficial to deep. So you start it the same way, you tie it down. But this time, instead of cutting both sutures, you would just cut the short end. The knot will still be deep, but now you have the long end still attached to the needle. And now you again go from deep to superficial, okay, near the corner, where you just placed your last suture. Pull it up. Now I'm going to run and do horizontally back and forth right at the dermis-epidermis junction. Instead of interrupting it, this will go continuously from one end to the other. So I start out in the corner. I'm going to go straight across the epidermis-dermis junction. Come straight across, and you need to have the same depth on each side so that the skin edges come together and don't evert or overlap. So as long as you're entering straight across and using the same depth into the dermis, And you would keep running that back and forth till you get the other end, and you tie a second so that there's no visible knots, and then you usually use some skin glue over top.